Welcome to Petgevity, the podcast that gives you the best advice to help your pets live longer, healthier lives. ADHD, it's everywhere right now. Across social media, podcasts and workplaces, people are questioning themselves in ways they never really did before. Traits once dismissed as lazy, oversensitivity, or lack of discipline are now being revisited through the lens of neurodivergence. Somewhere in the middle of that, I also found that I was affected by it too. For me, it was a watershed moment, and I stopped seeing traits as personal failings and started to learn to work with my brain, not against it. After getting my diagnosis, I started to wonder, could this new way of thinking also be applied to my dog? Could he experience something similar to ADHD, or are these behaviours just part of being a dog? Today, I'm joined by Dr Jacqueline Boyd, Senior Lecturer in Animal Science at Nottingham Trent University. Together, we'll explore the science behind animal neurodiversity, how it may present through behaviour, and why understanding your pet's mental world could help you become a better companion to them. Hello, Jacqueline. Welcome to the Petgevity podcast. We're going to start with some quick fire questions, and I would like you to give just yes or no answers. Ready?
Ready, yep.
Can dogs show genetic and behavioural signs of neurodivergence similar to humans?
Yes.
Can your pet be tested for ADHD or autism?
No.
Has understanding neurodivergence changed how you interact with your pets?
Yes.
And this is your full sentence answer now. What is the biggest misconception about neurodivergence in pets?
That it doesn't exist.
Love that. A couple of months ago, you wrote an article that got a lot of people talking. It was titled Autistic Dogs, ? Neurodiversity in Our Pets and What It Might Mean for Us. This is a topic that is close to my heart, so I'm really excited to dig into this in more detail. So first of all, I want to start with humans. What do we mean by neurodiversity in a human context?
Neurodiversity is this global idea of all of the different sort of makeups in terms of how we behave as humans and how we perceive the world, how we respond to the world, and our recognition that in the same way that we look different, our brains will be functioning in subtly different ways as well. And I'm hugely aware it's a massive field, of psychiatry and psychology. But I think what we can absolutely recognise in the human population is that we have huge differences in terms of how we respond to the world, how we perceive the world, and that manifests itself as neurodiversity. And then within that, we have neurodivergence, where we have specific neurotypes that can be acknowledged to respond to the world and recognise the world in very particular ways as well. I don't view them as conditions. They're very much differences. It's just where they kind of sit in the medical literature. We talk about them as disorders rather than differences.
I feel exactly the same. The idea that it's differences and not disorders helps us contextualize it much better. I completely agree.
Yeah, very much.
What is the biological basis behind these conditions in humans?
They're very much viewed as neurodevelopmental conditions, neurodevelopmental disorders, or as I would prefer, neurodevelopmental differences. There's definitely evidence that there are subtle differences in brain structures. Funnily enough, I was actually speaking to a colleague just this morning about equine brain structure, and this question has been floating around in the equine world. And there is definitely some evidence that there are subtle differences in the size of certain brain structures and brain regions that could be potentially linked to neurotype differences as well. We definitely see that in some of the human literature. And there's bits and pieces that are floating out in terms of literature relating to other animal species, and particularly animal models for these human situations as well. We also have some really interesting genetic aspects that are popping out. And there's actually quite a lot published about genetic variants in the human population that seem to have some linkage to some of these neurodevelopmental differences. And we definitely have in some of our animal models the same gene variants or the same gene mutations popping up. And there's been a couple that have been actually quite well published in animal models for particularly autism, well understood, particularly for genes that produce proteins that are responsible for cell-to-cell signaling, that where there's a gene mutation, we just don't have that same level of cell-to-cell signaling in the brain. And what that seems to manifest in the animals are behaviours that would be sometimes akin to some of the communication difficulties and differences we see, particularly in autists as well. So there's increasing crossover and increasing understanding of that crossover as well. And that's sort of actually where the article that you mentioned came from, was actually looking at some of this literature and what it actually might mean for the animals that we share our lives with as well.
So why do human and dog brains, share these similarities? Because essentially that's what you're alluding to. There's this continuity between the two worlds, but why? Why do you think that is?
The first thing is we've been around dogs for a long time. And the more we sort of understand about the human-dog dyad, the human-dog relationship, and the length of time we've actually spent with dogs, we are appreciating much more that actually there's been convergent evolution. So this idea that two species exist in the same space, in the same time, are being exposed to the same stimuli in the environment, the same environmental pressures. And as classically happens in evolution, we see similarities appearing in two very different species. The other thing that I think is really interesting about dogs, and this is sort of where my real interest comes into it as somebody who lives with dogs and works with dogs and wants to understand dogs an awful lot better, make the world better for dogs, is the fact that we selectively breed dogs. We've selectively bred dogs for thousands of years. We've selectively bred dogs because we like the way they look, we like the way they behave, we like their temperament, we like everything about them. And in many cases, we've actually selectively bred dogs for very particular sort of skill sets that often relate to, I suppose, the functions, and that sounds very brutal, but the functions we've actually needed those dogs to undertake. And that's where my real interest in this idea of neurodivergence in dogs comes into its own, because I live with a particular breed of dogs that many people joke, wow, they're interesting. But when I actually look at their original function, it makes perfect sense that actually they've acquired some of these genetic variants, probably very subtle ones, that actually mean they have some of these outward behaviours as well.
And to follow on from that, are there problems diagnosing animals with human conditions, if we call it that?
Yeah, absolutely. And I am hugely sympathetic to this. I very much recognise that there is a sort of deep, almost a moral and an ethical debate about giving other species human diagnostics. And by diagnostics, what I mean is, actually saying, well, this animal also has this condition or this disorder or this difference. And I'm hugely sympathetic to the fact that, as humans, there will be individuals that are really not comfortable with that at all. So that's one aspect to it. The other aspect, and this is one that's really pertinent, is the fact that actually many humans struggle to get diagnoses. Whether that's financial, whether that's actually just availability, sometimes that's actually simply lack of awareness and lack of kind of wider appreciation. And there's also the stigma attached with it And by stigma, I mean external stigma that can sometimes inhibit the diagnostic desire or diagnostic procedures. But more fundamentally, there's actually a problem with diagnosing conditions. And again, I struggle with that term, but diagnosing conditions that are very much often diagnosed in the human population through communication. And much as I like to think that we can communicate with animals, we certainly don't communicate with other species in the same way that we're communicating just now. So the diagnostic criteria that would be very classic in human diagnosis doesn't apply to our animals because we can't get them to fill out paperwork. We can't ask our animals to do that.
It's great to have a better understanding of the biology behind neurodivergence. So thank you. But this is an emerging area of science, and there's been a fair amount of opposition to the ideas of pets being neurodivergent. And you've touched on it, but I wanted to come back to it. Why do you think it is a controversial idea? Like, what's the core of that controversy?
Yeah, it's a great question. And it's something I've kind of, when I say struggled, I don't necessarily say struggled on a personal or a professional level. I think I find it quite interesting, some of the opposition. And that actually applies, I would say, to opposition to human neurotypes as well and human neurodiversity. But I also think there's a huge distaste almost for this idea of actually applying human attributes to a non-human species. Because we get taught, I was certainly taught it as a zoologist, don't be anthropomorphic. We should not be anthropomorphic. We shouldn't be giving, human traits and feelings to a non-human species. But the spin of that is if we have good anthropomorphism, we can actually start to understand another species an awful lot better. I think there's also a functional difference in that there's still, and I see it, I work a bit as a dog trainer as well, as a canine coach. So I see it occasionally happening where people will say, well, my dog should just do this. They are a dog. And I think that sort of feeds a little bit into some of the sort of kickback where people say, no, we can't have this discussion. We can't have this discussion that animals can be neurodivergent as well.
What is the difference between those two? Because you're seeing it as, a dog trainer in some capacity. What's the difference between that natural, even from my perspective of vet, as the kind of normal breed behavior, whatever that looks like, and neurodivergent behavior, whatever that looks like?
Yeah, again, great question. And I actually think there's overlap between this idea of genuine, and I use genuine in inverted commas, genuine neurodivergence and breed or types, for want of a better term. I can absolutely think of dog breeds and dog types that would be presenting behaviours or presenting particular traits that would fit much more beautifully with what we would possibly recognise as autism or ADHD like behaviours in humans. And I'll be very personal for a minute. I have Cocker Spaniels. I've got working Cocker Spaniels. I've had them for, 25 years now. I would absolutely say, and I've even heard some of my gun dog training friends say, most Cocker Spaniels are like, ADHD little boys. And it's a very kind of characteristic, ADHD, a small, excitable little boy, which again tells you something about our sort of stereotypes, if you like, for neurodivergence. And I can absolutely see that, and I've got certainly one of mine, he is the most impulsive boy in the world. I think he goes around the world all the time with intrusive thoughts, like just chase it, just chase it, just chase it. And I can see him dopamine seeking all of the time. So for me, he's almost at that extreme of probably neurodivergent. If he was a human, he probably would be. But I also see it in my other ones that the breed characteristics, they are busy, they are excited by novelty, they are stimulated by novelty, they are seeking novelty. So I see that as well.
I'd love to move on to how we can apply all this fantastic new knowledge. So, first of all, what are the negative effects of poorly managed neurodivergence in dogs?
That's a fabulous point. I think the first thing that would spring to mind is a lack of understanding from our perspective. We talk an awful lot in the animal world about meeting an individual's needs, and we don't talk enough about it from a human perspective. We probably talk more about it from an animal perspective, truthfully. So I think that's one key aspect of it, is actually thinking about meeting an individual's needs. And if an individual's needs are to be able to seek novelty, to be able to, respond to their kind of intrinsic desires, if we do not let them do that, we will have severe behavioural fallout. You might have dogs that are chasing, that, have zero recall because they are absolutely, they're not having their needs met in terms of activity or novelty or stimulation. So they'll go and do it themselves. A vacuum's created, they're going to fill that vacuum themselves. We might have dogs, and I'm particularly thinking about dogs just now, but this, probably applies to other species. We might have dogs in the house environment that become destructive, that become anxious, that certain stimuli becomes overstimulating for them, potentially noise reactivity. We might even see it in terms of sociability. So hyper-sociability, either with humans or with other dogs, or actually reduce levels of sociability. Now, some of these we'll see in certain breeds and types as well, because some of these things will be breed and type characteristic. And I firmly believe that as we learn more about this, we're actually going to recognise that certain breed and type characteristics have been selectively bred for neurodivergent traits because they've been beneficial. And that in itself makes almost perfect sense when we actually selectively breed animals, that we've been breeding for those neurotypes and neurological traits as well.
Practically speaking, how could someone who's listening in today learn or take something home if they feel their dog or one of their cats has neurodivergence? What's the practical thing that you would give them today and arm them in this journey of understanding them?
The first thing I would always say to anyone is keep some records. Big fan of record keeping. And while that sounds quite scientific, keeping some records can help you monitor, is this something that is consistent? So it might be noise reactivity, it might be not wanting to respond to an individual, whether that's human or another animal. Starting to keep records to actually say, is this a consistent thing? Or is this just a one-off? I'd also really strongly say from a practical perspective, because we actually know for many animals that behaviour and behavioural changes can be linked to pain, which is a whole other subject in itself, to actually practically rule out pain or veterinary causes for any unusual behaviour or behaviour that might be concerning you. That would be the other thing. But from a practical perspective beyond that is actually starting to really read what your animal is telling you and read what your pet is telling you. So if they're actually saying, I'm not comfortable in this situation, it might be, can I change the situation to make them more comfortable? Or do we have to be in that situation full stop? I see it in some of my training classes, that I will always try and say, both to people and dogs, this is supposed to be a place where you feel safe and you feel happy and you feel confident. And if there's something I can do that's going to help you beforehand or actually within the session, I will do that. And for some dogs. And interestingly, for some people, that will be, this is a safe space and a quiet space. If you need to take 5 minutes out and just go and calm down and just breathe and be zen-like, please go and do that. In other situations, I have snuffle mats and little ball pits, and it might be that, you know, a dog needs to just go and have a bit of a snuffle or play in the ball pit just to burn off some, and then they're settled. So I think it's also reading your animal, you know, and not making them do things. Now, that's not saying that there shouldn't be boundaries and there shouldn't be some clarity as to expectations, and it's not saying you can do whatever you want, but, you know, giving them some agency and giving them some choice in any interaction, I think, is hugely important.
Well, I think you'd be a wonderful therapist for humans, not just dogs at this particular point. It's the same. Sounds very familiar, so thank you. To extend that now, I'm going to really push you. ADHD medication is now, as we've seen in the last couple of years, it's a very popular option for humans. Do you think we will ever see those types of medications for dogs?
It's a great question. First thing is, I'm not a vet, so I can't diagnose, I can't treat, I can't recommend treatment, but it does raise some really interesting questions about how we potentially can, and I'll say, support individuals. There is absolutely value in recognizing that medication and pharmaceutical support can help mitigate some of the challenges that would be experienced where there are differences, and particularly neurological differences. My big concern, and this is speaking as an animal scientist, is that I would never want to be in a situation where they are being utilised to account for other failures in our management of species. I'm also realistic enough to know that sometimes a compromise does have to be made. You know, I'm not a zoo scientist, but I have many colleagues who work in the zoo environment, you know, that will talk about these situations where, you know, animals are in situations and being managed well in situations, but are still not coping. So we actually might see the use of pharmaceutical compounds to help them cope, whether that's short-term or long-term, that can be utilised. So I can see that there may well be value for it in certain situations, but I would always want to take the first step personally of, are there other ways that we can meet this animal's needs, rather than actually going straight to that as an option.
As a vet,
which is always great.
Which is always fantastic. I understand the way that you're navigating, and I think it's the best way to navigate it, because what we are alluding to is that if there are ways to do that without medical intervention, that's fantastic. But the same goes for individuals, humans who operate within the world and have been told they have to be one form of themselves, which is to operate in the way that, you know, non-neurospicy, shall we say, find a little bit easy to access. And then if you're neurodiverse, how that, you know, accessing that world can be really difficult. So I understand the diligence that you've applied to that, because I agree, you know, what is the greater good, you know, holistically speaking? And that's a really big question. My last question is, what is the one thing you, Jacqueline, want people to take away from the discussion about neurodivergence in pets?
I think the one thing I would really want people to take away from this is to remember that every animal that you interact with is an individual. And while we can talk collectively about dogs, your dog is not the same as my dog, which is not the same as somebody else's dog. And even if they're related or they're living in the same household, they are individuals. And as individuals, naturally they're diverse, and that will absolutely manifest in neurodiversity and potentially neurodivergence as well.
Thank you, Jacqueline. That's a wonderful endpoint to end on.
I hope that's helped.
Thank you for joining us. I'm your host, Fabian Rivers, and this podcast is brought to you by Petgevity. If you'd like to find out more about how we can help your pet live a longer and healthier life, The link is in the show notes. This podcast is produced by Flamingo Media. Thanks, and see you next time.